Hi everyone, healthcare analyst David Williamson here with the always popular Ask a Fool segment, and today's question comes from Peter Tan, who asks, what's your foolish take on Prana Biotech? Ticker symbol PRAN. Well, I understand the enthusiasm for Prana. It's targeting intriguing indications, Alzheimer's disease, Huntington's disease, all with the same drug at PBT2. And there really aren't good treatments for either. And that is a bit of my concern with the stock. The degree of difficulty is through the roof with these two indications. With Alzheimer's, we still aren't really sure what to target. It makes designing a successful drug difficult. Prana's theory is that copper and zinc play an important role in dissolving beta amyloid plaques. Now, we've seen a lot of companies chase beta amyloids with limited success. Johnson & Johnson's bapineuzumab and Eli Lilly's solanezumab were high-profile phase 3 failures. Eli Lilly is soldiering on because the reward for creating a successful treatment is so high. Now, I'm not one to necessarily point to a competitor's work, but Adam Fierstein over at The Street does a great job discussing the Huntington opportunity and why success is a long shot for Prana there as well, and I do agree with his comments. Summer Street came out with a negative note on Prana today. Shares are down about 10% because of it. Summer Street wrote that they are not enthusiastic about the drug's purported mechanism and that they are also not impressed with the data to date. Now, Prana is valued at roughly $350 million, and it has tripled over the last 6 months. Some would see that as the market catching on to its potential, but to me, it's a red flag that despite the rocket growth, the market cap is still tiny given the opportunity. Any drug successful treating Alzheimer's would be a blockbuster. I'm not opposed to playing the biotech binary event game, but limiting risk is important. The key is having a strategy where risk-reward is in your favor, and given the difficult indications, I have to think failure is high. So if the trials don't work out, where is the stock? That's the question investors need to be comfortable with. There are two other drugs Prana is advancing, but neither are in phase 1. Prana, for all intents and purposes, is PBT2. Without it, there's no reason to expect the stock to be higher than it was a year ago before the run. So careful investing out there. Thank you for the question, and stay tuned to Fool.com for all your healthcare news. Fool on.